Schistosomiasis Scientific, Social and Religious Horizons, Dr. Nabil Moussouf, Egypt. Schistosomiasis, also known as bilharzia, is a parasitic disease that leads to chronic ill health. It is the major health risk to the rural areas of central China and Egypt and some other developing countries. Schistosomiasis has been recognized since the time of Egyptian pharaohs in 1851. Theodore Bilharz, a German pathologist, discovered the worms of schistosomiasis and it was named bilharzia. The main forms of human schistosomiasis are caused by 5 species of flatworm known as Schistosoma mansoni cause intestinal schistosomiasis and is prevalent in 52 countries and territories of Africa, Caribbean, the East Mediterranean, and South America. Schistosoma japonicum, Schistosoma mycnogi cause intestinal schistosomiasis and are prevalent in 7 African countries and the Pacific region. Schistosoma intraculatum is found in 10 African countries. Schistosoma hematobium causes urinary schistosomiasis and affects 55 countries in Africa and Eastern Mediterranean. Infection occurs through exposure to infected water used in normal daily activities such as personal or domestic hygiene and swimming, or by professional activities such as fishing, rice cultivation, and irrigation. Due to lack of information of insufficient attention to hygiene, infected individuals may contaminate the water supply with feces or urine. The eggs of the schistosomiasis somes is the excreta of an infected person open on contact with water and release a parasite, the Miracidium. To survive this motile form must find a freshwater snail. Once it has found its snail host, the Miracidium divides, producing thousands of new parasites. Cercaria. The cercaria are then excreted by the snail into the surrounding water. They can penetrate an individual's skin within a few seconds, continuing their biological cycle. Once they have made their way to victims' blood vessels, within 30 to 45 days, the parasite is transformed into a lungworm, which is either male or female. The female lays from 200 to 2,000 eggs per day over an average of 5 years, according to that species. In the case of intestinal schistosomiasis, the worms stay in the blood vessels lining the intestine. In urinary schistosomiasis, they live in the blood vessels of the bladder. About half of the eggs are excreted in the feces, intestinal schistosomiasis, or in the urine, urinary schistosomiasis. The rest stay in the blood, damaging over vital organs. It is the eggs and not the worm itself which cause damage to the intestines, the bladder, and the other organs. Liver fibrosis is the most important complication of intestinal schistosomiasis, especially schistosomiasis mansoni with portal hypertension, splenomegaly, and esophageal and gastric varices with acetized splenomegaly, hepatic coma, or hematomesis, which may be life-threatening. Pulmonary hypertension appears to be due to obliteration of pulmonary arterioles by granulomatous inflammation induced